Hi, so this is Mitanshi here, and it's been quite a journey for me to be here. Talking about my academic expertise, I hold a Bachelor's of Science in Psychology with Counseling Skills from Middlesex University, Dubai, and a Master's in Clinical and Health Psychology from the University of Manchester. And I really believe that all of my academic expertise has really helped me to build upon all the research and practical expertise that I've been able to gain so far in the areas of clinical and health psychology, be it working as a clinical health psychology trainee at a mental health clinic in India or just as a advisory research assistant here at a digital mental health organization in Manchester. So that's all over there in about me. Apart from this, I've also been currently working as a graduate teaching assistant here at the University of Manchester, supporting learning on various Bachelors of Science and Psychology units. So it's been such an exciting journey for me.
Brilliant. Thank you very much, Mitanshi. That does sound like a exciting journey. So just to recap, you're a second year full-time PhD student here at the University of Manchester currently. If you could now please just tell me about that programme of work. So what are you going to be doing for the next kind of 2 years on that PhD?
Sure. So I am a second year full time psychology student, basically in health psychology. Talking about my work basically looks at understanding the role that the family could play in the development of weight related stigmatization during pregnancy in urban India. So, so that it's easier for our listeners to understand, weight stigma basically refers to bias or discrimination which is targeted towards individuals regardless of their body weight. So the interesting bit in here, I would say, is that weight stigma has been so well studied in the general population, but with so little understanding on how it could play out during pregnancy. So that is what my research is looking at to bridge the gap and to understand how weight stigma looks like during pregnancy. So with respect to the research that has been conducted, it has been on understanding weight stigmatization from sources like healthcare providers and media during pregnancy. And a really important source which has been missed out in the literature is the family. And I think this is huge because if you talk about Asian societies like India, the family plays such a huge role in supporting women with their weight related behaviors like diet and physical activity. So this is like the gap that we're trying to address in over there. And within India as well, our focus is on urban India because this is where maternal obesity rates are continuously on the rise and anti-fat attitudes are spreading rapidly.
Brilliant. Thank you very much. It sounds very, very exciting and we can hear your passion. Can you just tell me a little bit about, I believe you're designing a qualitative study at the moment. Can you tell me a little bit about that study?
Yes, sure, that's great. So my qualitative study is basically, qualitative study has more to do with understanding experiences around things. So my qualitative study is looking to understand experiences of weight-related communication from the family during pregnancy in urban India. So for that, we have sent this study to the ethics right now. So we're seeking ethical approval, and it's a long process because a lot has played out to get in over here. We have been designing materials around our study, which is basically an interview guide talking about questions we're going to be asking women about the study and things around in over there. So we're waiting to seek ethical approval, and that's when, once we get that in, we're going to start data collection soon.
Brilliant. So soon, hopefully, you'll be interviewing pregnant women in urban India about their experiences of weight communication from family. Brilliant. Thank you. Could you tell me a little bit about why you're interested in this topic area and what brought you to it?
Yes, I think that's a great question in there because personally, I was, like I earlier mentioned, I was working as a clinical health psychology trainee back in India, and we were working on this program which was called Mind Your Food program. So this was basically, I was working with psychologists in India to understand factors which would help people to eat more mindfully or in a healthy manner. So we were having this discussion generally for people who wanted to enroll in this program about what they think factors which could help them to eat mindfully and things around that. So there was just a jump over there where people were like, we could eat mindfully, but there's so much which goes around. There's so much of stigma around weight and how we could eat mindfully. I mean, it's so difficult to eat mindfully. I mean, when so many societal factors are at play, someone just randomly mentioned weight stigma in over there. So I think that was something which brought me to the field initially. So I just, like how random people do, you just start Googling stuff and you're like, okay, this sounds so interesting. We go and find out more about this. So I went in and I started reading about weight stigma in general. So weight stigma, when I started reading about it, it was just like there's so much of literature out there. I mean, people are studying it among so many different populations, like adolescents and young adults and whatnot. But then I just kind of there was just one article in there. Like sometimes things just like come to you naturally. There was just one in there. It was like weight stigma during pregnancy. I was like, oh, that sounds quite cool and interesting because I mean, women's health has been something which has been so interesting to me, and I've been so passionate about it. So it's like, this sounds quite cool. So I went about reading in there. I always knew I wanted to do a PhD, but I was like, I'm not sure which area appeals to me the most because I was just gaining so much of experience during that time. So when I started reading in there, it was something which I kept on reading for days and days and days. And I was just like, all right, this is something which is so catchy and interesting to me, and this is something probably I could go about reading for like a long, long while. So that's how I got in, and I thought, this is something which I could potentially do some research around. And that's when I drafted my research proposal, and that's when I started approaching people around, and that's how I approached my supervisors, and that's how the entire journey has begun for me.
So you've told us about your interests and kind of the rough plan of what you want to do. People might be listening to this thinking that they fit in your kind of plans in terms of them being pregnant, maybe in the region of India that you've talked about, or they're just generally interested. How can people get involved maybe in your work or find out more about your work?
Yeah, so I think that's quite an important question because we as researchers obviously want people to get involved in our research because those are the people we're doing research for. So especially we're looking to involve our target audiences and relevant stakeholders in there. So I think one great way of doing that is basically by partnering along with our relevant stakeholders and target audiences um, in the designing, planning, and conducting of a research, which is popularly known in the research world as public and patient involvement and engagement, which is like PPIE. So we're looking to form one such PPIE group for pregnant and postpartum women in urban India currently. So we're looking for women who will fit our eligibility criteria. So we're going to be posting in details about this on our social media platforms like Twitter and Instagram and Facebook and all of that. So this will be out soon. And we're also currently in talk with pregnancy care centers in urban India who will help spread the message for us as well. So if you do fit in any eligibility criteria, you could get in touch with me, obviously on my university address. Uh, with respect to relevant stakeholders, I think that they have played a massive role as well in the designing and planning of this research study because we've always been in touch with stakeholders like obstetricians and gynecologists in urban India because we have faced massive challenges with respect to recruitment, and they have provided their insights to us, which have been really beneficial in guiding the recruitment planning for our study as well. So I think there are like great and massive multiple opportunities for people to get involved in the research, definitely.
Brilliant, thank you. So once that ethics procedure is done and you've got that approval, like you say, it'll be out there on all those different platforms advertising for people to see. And then you said in the meantime, if people want to get involved with you, they can use your email address from university. Do you want to tell them your email address?
Please to get in touch at Mitanshi.Dhanwani at manchester.ac.uk, a typical university email address in there. But yes, you can get in touch over there. And we are also putting out an advertisement post along with obviously on our social media platforms. So that'll have a QR link as well, which will take you to a video talking about the study because I think when you're on social media platforms, they don't get to see you as a researcher. They don't get to hear your story or understand why the research is so crucial and important to you. So I think it is going to send out a voice for all the people who want to participate and get in out there. So we're really looking forward to it, and it's great to have as many people as involved in the research because it is for you at the end of the day, and that's what we want. We want to make you get the best out of it.
Brilliant, thank you. And that feeds really nicely actually into the next thing I wanted to ask you, because I wanted to ask you what you want to gain from this PhD. So, at the end of the 3 years, what do you want to have gained?
Yeah, so I think that's it's a very personal question as well, but it's something which because you're doing so much of research and it's important to you as a researcher as well as for the people that you're doing it out there for. So I think on the research level, I think I would say is that our end goal is basically to help improve the ways in which families communicate with women about their weight during pregnancy. I think the important thing over here is to understand that since the topic area is very niche and the research is very in the upcoming stages, we're looking more rather than an outcome, we're looking to build theory around weight stigmatization from family during the pregnancy. So that is our goal at the moment. And I think we are doing a lot of work. We're quite hopeful and confident that we're going to be able to achieve this because we're doing a lot of work around this in different ways. We're looking at understanding experiences of weight related communication from the family during pregnancy. We're looking to understand the impact that weight stigmatization from the family could have on behaviors like diet and physical activity during pregnancy. And we're potentially also discussing options if we could design like a questionnaire to study weight stigmatization from the family during the pregnancy. So there's a lot which is going on over there for us. Personally, as a researcher, I think what's exciting for me is that I'm really getting to own my skills because I'm doing work around which I have never done before, be it like doing interview questions for my study, which I've not done before, or just be here sitting and talking to all of you as listeners about my study. So even if that is quite exciting for me, so I think I'm really growing as a researcher on a personal level. And also, professionally, I'm working as a graduate teaching assistant alongside all of this. So I think this is really preparing me well for my desired future career in academia. So I think it's all of it nicely coming together at the moment.
Brilliant. That is very exciting to hear. And on that note, if someone's listening and you've just sent that bit of inspiration to them, be it they're a psychology student or that they're in India and they're thinking, oh, Manchester University, or this sounds like a good career route, what tips would you have for anybody listening now inspired by what you've just said?
So I think I'm a person who leads more from the heart. So I would say that follow your passion. I mean, discover your drive because when you understand what you're most interested in, what you're passionate about, you're going to be doing so well at it. So I think first is like be passionate about what you want to do. Secondly is I think to understand your approach better. So where do you want to go? Where you're looking to be? What's your end goal? So I think a lot of people, when they are looking to do a PhD or a rigorous program like this, I mean, it's obviously important to understand what you're getting into. So some people are like confused with like, do I go on the research track or do I go on the clinical track? What is it? So do what appeals to you as a person and what feels right for you. So I think those are the things which has really helped me. And a massive thing is also working alongside people who have the same vision and goal as you. So things like this, even though if it's your project or something, but you're bringing together a team. So see people you can share similar visions and goals with. And I think when you work together and you grow together, you can achieve like great things in life. So I think that's what I have done.
Brilliant. Thank you very much and good luck for the next couple of years.
Thank you so much. It's been wonderful.